Welcome to today's webinar, How Employers Prepare for the Great Reopening, Practical Advice for Employers Easing Out of Quarantine and Getting Back to Work. My name is Christy Gupton. I'm an Employee Benefits Advisor at Custom Benefits Solutions, and I'm joining you today in collaboration with the Burke County Chamber of Commerce. Together, we want to bring you some good tips and food for thought, tips that would be of value to the employers in our area. So let's get started. As we prepare to phase out of quarantine, we're watching data from some other countries to try to predict what we might need to do here in the United States. You might look at this and think to yourself, why does the United States seem to be outpacing the rest of the world in COVID-related cases? But just remember how much larger the United States is compared to a lot of those other countries. So one of the factors that we're looking at the most are some of the European countries as a group. And then we're definitely watching China because they had the first case. And as they have phased out of their own stay-at-home mandates and started to resume some economic activities, we're watching the spikes. So this is just important data to be watching, and we wanted to share it with you. Some other things we want to share with you are resources at your fingertips. The Centers for Disease Control has many important resources for employers. They're all available to the public and they're free. Articles and videos and guidance, other state-based mapping and data points, links to state and local health resources, and some initial guidance on reopening. For clients of Custom Benefit Solutions, we're definitely creating some resources for our clients, including a portal where they can log in and view HR policies, reference guides, any kind of employee-facing material that would be a good conversation starter and something that could be sent out to educate employees with. Definitely co-branded materials. And through also the Burke County Chamber of Commerce, if you're a member with the Chamber, then you also got this email that I got last week. It has a link to this website. So it has many different very good resources for employers to look at, for employees to use. And the Chamber's been wonderful through this whole process, making sure that its members had everything it needed to apply for Small Business Administration loans and other federal resources. So I really thank the Burke County Chamber of Commerce for being such a leader in this area and making sure their members were taken care of. I do have some additional sort of practical daily advice for you. So in addition to all of those other resources, here's just a few good tips. Just because we're considering coming back into the workplace, it doesn't mean that we need to return to any sort of close contact with each other. So stay conscious of the fact that there's still an outbreak of a highly contagious and in some cases a deadly virus. So don't rush to crowd around the conference table for meetings. Keep those on Zoom or Skype or whatever teleconferencing software you're using. Set timers on your calendar to wash your hands and keep hand sanitizer scattered all throughout the office. As you navigate the workspace, make sure you're giving other people plenty of room to walk past you without, very much contact at all between your path and their path. Just also remember that coronavirus is the same virus that causes the common cold. So it is highly contagious. It's just that COVID-19 is the very virulent mutation of that virus, and we still need to really be on guard. So as you bring employees back into the workplace, Make sure you're in constant contact with them virtually through educational materials, newsletters, videos, and conducting meetings virtually. I also have some fairly specific advice for you about elective procedures, elective surgeries. I want you to be able to see that you have some options, and I think it's just good advice right now to make sure that if elective surgeries are something that need to happen, that you seek out a independent, freestanding, high quality ambulatory surgical center and use the hospital for emergencies only. So things that are not elective. So if something is an urgent nature and it can't be planned for, of course, that's what hospitals are there for. But if there's an elective surgery that is in the best interest of your workforce, your employee that needs, say, a knee replacement or something like that, it's just a good idea to use a freestanding ambulatory surgical center for that anyway, even without the current risk that lies inside, the hospital doors. It's just a good opportunity to direct some of that elective care to a place that does have less risk right now, no doubt about it, but also a place where you can adequately evaluate the quality and the cost part of the equation. And so this is very important for self-funded health plans to sort of tee up these procedures ahead of time and go ahead and negotiate a cash price. That always gets you a better outcome and a better cost than just letting that arbitrarily go anywhere the employee wants to go. So, speaking of elective procedures, it's always a good idea to understand that not every hospital is created equal. Learning about hospitals and how they are graded for safety and quality is important. So enter the Leapfrog Group. Leapfrog is a non-biased, nonprofit group that sends safety and quality surveys to hospitals every year. They're filled out based on several factors, and the Leapfrog Group assigns a grade, like a report card, to hospitals based on their safety and quality. So you can see here that our local hospital in Burke County gets an A grade. But if you have employees in other areas, it's important that they determine the hospital that scores the best grade in their area. This would have a really positive effect on the quality of the procedure in question, the amount of time your employee spends out of work, and it would hopefully help reduce or eliminate the need to repeat that procedure or fix any surgical errors. So larger employers should really collaborate with their employee benefits advisor to pull up any pre-certs for upcoming procedures and help employees determine the safest place to have that procedure done. If your plan can strike direct contracts, which is always the best idea, that is something that you should definitely look into. So if striking a direct contract with local providers, especially a local surgical center, is not something that your advisors ever talked with you about, I would love to explore that conversation with you. So let's put that on the calendar for sometime soon. So again, Leapfrog is evaluating safety practices, never events, hospital-acquired infection rates, whether the hospital has an antibiotic stewardship program. And so they do these surveys annually, like I said, and make that transparent to the healthcare consumer. And we believe transparency leads to improvement. And so you can see these grades out in the public domain at hospitalsafetygrade.org. And for large self-funded health plans, the Leapfrog value-based purchasing program that is shown there on the screen is definitely something that you should have a conversation with your advisor about. It's definitely a program that I put in place in all of the self-funded plans that I work with. So we'll talk more about self-funded plans in a few minutes. A couple of other resources from Custom Benefit Solutions that I really felt would benefit Burke County Chamber members if they could tap into them. First of all, we offer our clients a learning management system. So for the professional development and personal training and development on many topics, we apply this kind of resource to what our clients can access for free. And you can assign courses and curriculums to employees based on what kind of training you want them to have, and really design that certificate program yourself and offer it as just a part of that employee's employment with you. So speaking of training, COVID-19 is definitely a topic that would be helpful if employees passed a course that certifies they are knowledgeably practicing safety measures inside your workplace and home. So to that end, there is a great curriculum around COVID-19 with 5 courses that are already, ready to go. So, once the employee finishes this curriculum, you can offer them a certification with, like maybe a little certificate of some kind that they can display at their desks. And one other thing I thought was really important was your ability as an organization to certify that your entire workforce has gone through this training. So I think the ability to certify that all employees, excuse me, in your organization have passed this safety course on COVID-19, that would make an important statement to your work that your workplace is safe to enter and do business with. Imagine being able to put out a press release that your employees were the first business in town to achieve this certification. So I know that some folks are on the webinar today from Van Appen Marketing, and they're also a member of the Burke County Chamber of Commerce. So they would absolutely be someone that you could work with to develop a press release like this. And through this learning management system, you could substantiate and verify that all of your employees had achieved these certifications. And so anyway, we just thought that this was a really important tool for this time of navigating this pandemic and helping facilitate the return to work and the return to normal activities, as being certified, as being trained in how to safely practice the behaviors that keep this virus at bay and not being spread. So another way that we support our clients to communicate with their employees and keep them engaged in constant communication is through periodic videos and newsletters and other tools that provide sort of pre-created employee engagement tools that are co-branded with your agency logos. And so this is just another thing that we provide to help keep employees engaged in your company culture. Another tool coming soon from Custom Benefit Solutions is called ThinkHR. So what is ThinkHR? Let's take a look at it. It includes a compliance library. It supports your organization whether you have an HR professional on staff or not. So with a huge resource library and a live HR certified professional hotline to call anytime you have questions with, this is just a great tool. But the piece of ThinkHR that I really want to highlight right now is the Living Handbook. So let's talk about what is the Living Handbook. So no matter what size an employer is, whether they're small or large, they all need an employee handbook. With ThinkHR, your handbook is easy to design, write, and keep updated all year long. Here's how it works. You design your handbook by answering a few easy questions based on where you operate, how you want it to read, what states you do business in, how many employees you have, so on and so forth. It takes as little as 30 minutes to design. I think I spent about an hour getting the skeleton of my employee handbook together. And then periodically, I'll get notifications from ThinkHR. So this is a glimpse of my inbox the last time I received a notification from ThinkHR, and it just let me know that I have new alerts for my handbook. So anytime a new regulation is passed or a new law or a rule from a regulatory agency is passed, those additions or new language that I might want to incorporate into my handbook is sent to me in an alert, and I can either approve it or ignore it if it doesn't apply to me. But if I approve it, then it goes ahead and adds the language to my handbook. It automatically sends the updated handbook to my workforce, and then gives them a chance to review it and sign off on it. And all of that is documented inside the ThinkHR system. So I think this is just really important for employers of any size, so that you don't have a handbook that costs a ton of money to create in the first place, and then it sits on a shelf for a year or 2 years or 5 years at a time, gathering dust, not being updated. It's constantly updated all year long, and this is something that Custom Benefit Solutions clients are afforded the right to use for free. So outside of being a client, an actual client of Custom Benefit Solutions, I wanted to let you know that there is a resource I'm making available for free to anyone on this webinar today. So take a second and just write down the address of this COVID-19 Resource website. It is really very robust website with lots of tools, pre-populated letters, policy and procedure language, videos for employees, just all kinds of things are in this tool, and I'm just wanting to offer it to anyone on the webinar today for free. Let's talk about health plans. Affording quality healthcare solutions is a huge concern for employers of every size. So for today's talk, we've sort of segmented employers into 3 different size categories. So for small business plans, we want to talk about groups of under 20 employees, for the small business plans. Then for medium-sized businesses, that's going to be for employees 20 to 100. And then for the large employers with self-funded health plans over 100 employees, we've got something in here for you too. So there's a little something. I have a case study for you for the small groups. So I took an example of a small business with less than 20 employees, just trying to buy a good health plan for their workforce. It always starts out reasonable at first, and then the cost increases start coming in the second year, and they really never stop. So I picked a plan that has a very typical plan design, a $1,000 deductible and a $4,000 coinsurance with some moderate copays. So with that in mind, let's take a look at how a Blue Cross plan for a small employer compares to a non-insurance option called Sedera Health. Sedera is a medical cost sharing organization, but just happens to have an employer platform so that employers can offer this medical cost sharing community as a health benefit to their workforce. So let's take a look at it. The way I decided to give you a glimpse of how this works is by picking a typical procedure. So I picked hysterectomy without complications. This is a real life scenario. I have the itemized bills from the employee and permission to talk about them and even distribute that itemized bill so you can see that this is a real thing. And I took this from a client of mine that they're only a client for ancillary and voluntary coverages, so I don't handle their health insurance because they are on the state health plan. So this happens to be one of my local government clients, and for health insurance, they're on the state health plan, but I help them with everything else. But the reason I decided to use this is because you'd think the state employees health plan in North Carolina is the largest health plan in the state. In some cases, it might be larger than than certain state government. Excuse me. The state health plan in North Carolina has 750,000 members, so even the members on the state health plan might even outnumber states themselves. So there might be some small states in our country that don't even have as many citizens as the state employees health plan in North Carolina has members. So we took this procedure of a hysterectomy without complications, and we thought, okay, let's go ahead and just track what was the total cost. So the bill tallied up to right around $41,000. And you'd think with as large as the state health plan is, that they would be able to have the most leverage and get the best cost for their members. But I think you're going to see here that that's actually a misconception. So the employee portion, of course, was the $1,000 deductible plus the $4,000 co-insurance, not counting the co-pays for office visits and other things. The anesthesiology on this procedure was out of network, so that created a surprise bill of over $3,000. Oh, and by the way, even though this employee was nearly 60 years old, the hospital charged her $100 for a pregnancy test. I thought that was kind of comical, so I put it in here. And totaling her cost, her own out-of-pocket cost, at over $8,000 for this hysterectomy. Let's compare that to how that would have been covered under a medical cost-sharing plan like Sedera. So first of all, because Sedera members present themselves as cash pay patients, they get lower starting costs in the first place. Look at the difference of how much less that hysterectomy is when you decide that you're going to pay cash or use a cash pay rate as opposed to using a Blue Cross and Blue Shield rate. So when I say that the members of the North Carolina Employee State Health Plan should, with all the leverage and the buying power that they have inside that plan, should be able to get the best price for healthcare, but honestly, it doesn't ever work out that way. So in medical cost sharing, you choose an initial unshareable amount that's almost the same thing as a deductible. So I applied a $1,500 initial unshareable amount to this example. Since there's no network and no copays and no coinsurance, that means there was also no surprise bills. That $8,500 cost was the total cost, and it was disclosed to us ahead of time because we represented the payer as a cash payer. So her total cost would have been $1,500 for the procedure as opposed to $8,000. And I thought that was really important to point out. So we can see the out-of-pocket costs are lower. What about the premium? The premiums that you pay every month and that are shared with your employer. So first of all, let's just take a look at what the costs were inside this health plan. So at $499.50, and the employer pays half, and then the employee would pay the other half. If it was employee spouse, it's over $1,000. The employer pays half of the employee, and then the employee pays the rest. So this repeats itself for each tier based on what tier the employee participates in. Here's how it would look with Sedera. The employee-only premium is $143 a month. Many employers pay way more than this, and certainly in this scenario they do. So I have had it happen almost every time where the employer says, oh gosh, the Sedera contribution is only that much. I'm just going to pay 100% for the employee. And in that scenario, if it's an employee spouse or employee children or employee family, if the employer is paying 100% of the employee cost, then what's left over for the employee to pay for their dependents is much less also. So think about this in real numbers. I mean, this represents about a $10,000 a year savings for families. So if you took the numbers from that family premium down at the bottom, employee plus family, and you looked at how much less it costs for employee family on Sedera, and you do the math and you multiply that out for the year, that's about $10,000 savings, not counting the out-of-pocket savings that we displayed on the prior slide. So I think it's very important for small businesses to really think long and hard as they sign those checks every month to Blue Cross. What else is out there and what else could help my employees at a lower rate? Let's talk about mid-sized businesses. So for these next few slides, we're going to be referring to employers with 20 to 100 employees. So the chambers of the western part of the state, so here circled in blue, there are 26 chambers of commerce that have come together and banded together to pool their collective buying power. And they have struck a deal with Aetna and Mission Health Partners in the Asheville Chamber of Commerce. So through Aetna, they have put together a great health plan where chamber members get discounts, get administrative credits, but still have all of the protections of a very robust, plan from a big insurance company. Aetna Funding Advantage is a level funded plan. Level funding is really sort of a hybrid between self-insurance and fully insured plans. And so it gives you all of the stability of a fully insured plan where you have the same monthly premiums every month during your plan year, but there's an opportunity to get money back at the end of the year if your premiums outpaced your claims. So in other words, if you didn't spend as much in claims as you paid in premiums, then you get the leftovers back, at least a portion of it. So let's just remember that the track, like this chart displays on the left, the track that most insurance plans are on is just straight up, 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 and up since in the last 20 years. We've not seen very many declines in health insurance premiums, but the Aetna Funding Advantage plan is a way to kind of outthink that and apply some new knowledge to health plans where the employer can get some of their money. I wanted to use another real life example to talk about this as well. So let's take a plan with 20 employees as an example. And this is actually a real example. So I found a plan. It had monthly premiums of $1,084 per employee per month. So that's roughly over $21,000 a month, $260,000 a year. They got no claims data, so that's why it was such a surprise when the group got a 25% increase, which their prior broker said they negotiated it down to 19%. But that still would have been $309,000 for the next year for the same exact plan that they had. So we decided to do a survey, an anonymous survey of employees, and just basically ask them what kind of use they were getting out of their health plan. And the survey revealed that there was very little usage of the health plan going on. So after a series of other things happening, the decision was made to switch to Aetna Funding Advantage from Blue Cross. Here's how that played out. The initial quote that they got for the Aetna Funding Advantage was $1,028, and after the underwriting process, that did hold, and so that's $20,560 per month for those 20 employees, and so that represented a little bit of a savings from the prior year at $246,000 a year. But with the Aetna Funding Advantage plan, they got claims data, they got prescription utilization data, they got some quality data on the providers that their employees were choosing. And with me as their advisor, we were able to interpret that data for them and help them understand how to continue to drill down with healthy behaviors and smart choices. And so at renewal, the data showed that the plan was only being used about half as much of the premiums that the employer was paying. So they paid $246,000 for the year, their first year, and they only used $135,000 in claims. So that's $111,000 left over. And per the terms of the contract of Aetna Funding Advantage and how it's set up, the plan sponsor keeps 50% of the leftover money at the end of the year. So they were able to retain $55,000 of their premiums that were unspent for the year, and that was reinvested back into the plan. So they decided to spend that money lowering deductibles and copays and coinsurance and paying even more of the employee-only premium than they had the year before. So that is just a glimpse into Aetna Funding Advantage, and let's move on and talk about large self-funded health plans. Think about a large self-funded plan kind of like a ship, a container ship. And so each of the containers that the ship carries are kind of like these bricks that build up a health plan. So employer-built healthcare is what we call it. Each of these bricks represent a piece of the health plan that is designed to integrate and work within the other piece and round out and build out a quality self-funded health plan. And each of the pieces is a cost containment strategy that works to help make sure that high quality care is being paid for at a fair price. And so in the prior slide, where I mentioned that we sometimes help self-funded health plans direct elective procedures and surgical care to specialty hospitals and centers of excellence. Well, that is managed by this piece, the utilization management, disease management, case management function of the self-funded health plan that we've designed. And so that is simply one piece of the pie that goes into constructing a great self-funded health plan that's employer-built as opposed to insurer-built. So I just want you to see that even in our inspection today of affordable quality health care for employees, especially in the face of a global pandemic, no matter if you're small, medium, or large, there's a way to construct a quality health plan that provides your employees with the best care at the most fair price. I also want to talk a little bit about life insurance. So I caught this story on April 17th, incidentally, last night I also saw another story almost exactly like this in the Wall Street Journal. It's saying that some life insurance companies are pulling back and they're deciding not to issue policies for applicants during the uncertainty of this global pandemic, COVID-19 pandemic. And so I predicted that this was going to happen, and in preparation for helping my clients offer the very best benefits to their employees, I went ahead and to insurance companies And I asked them to do a few things, especially on behalf of older employees. So age 50 and 60 is kind of where I asked for the most concessions. And so I was able to get up to $250,000 in face amount on term life for ages up to 50 years old with no medical exam, and then up to $150,000 for ages up to 60 with no medical exam. So this was an important ask, and I thought it was, worth my time to advocate like this on behalf of my clients. So in the face of this global pandemic, if your employees need better life insurance options, you should know they are out there, and I already negotiated a great deal on behalf of my clients. So these plans are offered on payroll deduction. They're voluntary plans, so this is something the employee would buy under the umbrella of an employer, but be able to pay for it themselves. But it's portable, so the employee owns the policy, and the rates are guaranteed for the length of the term. Terms that are available are 10 years. Actually, I forgot to put 15 in there, and 20 and 30 years. Plus, there's a whole life plan that has very similar underwriting concessions, and whole life premiums are locked in for life. So those premiums never go up for the employee. So I want you to draw your attention to the blue line and the orange line on the graph, on the chart. So the orange line represents a typical group term life plan where the rates sort of ratchet up every time the employee ages into a new 5-year age bracket. But the blue line represents the level term life that I negotiated for my clients, where the employee is able to lock in a flat rate that stays that same rate for the length of the term. So in this example, we used a 30-year term, but if the employee only wants it for 20 years or 15 years or 10 years, that rate is locked in for that number of years that they chose. So this is really important because sometimes you can get sort of blindsided in your 50s and 60s by life insurance rates that really jump up when you need it most. So for group term life, we just thought that we could do better, that the status quo was really no longer good enough. And that kind of leads into the next slide. I think it's important to consider that even though there's a lot of uncertainties, this time in our lives is a great time for a reset. So like I just said, the status quo is no longer good enough. It's just time to hit the reset button and start asking questions of ourselves that, maybe would lead us to say, we've got some changes we can make and they've been long overdue. So now is a great time for a reset. One more quote I'd love to share with you comes from a doctor, a direct primary care doctor out in Colorado. He said something the other day that was just so profound. He said, the opposite of cautiousness isn't always carelessness. Sometimes the opposite of cautiousness is courage. So I think that is a great quote to just let you know that we should not allow fear to hold us back. So right now, during this global pandemic, Custom Benefit Solutions is still doing virtual consulting, virtual setup and implementation, employee education, enrollment, and service for now. We really are people. We love to work with people and work with employees. So until the situations of the pandemic change, we can do all of that virtually. But once we get past this, then we are definitely available to you in person, as we always have been. So in summary, I just want to remind you what we all talked about. This was a great opportunity to look at some resources and tools for employers of any size. A medical cost sharing platform for small employers, less than 20 employees. That is a great alternative to a high cost health plan. Some life insurance options for employers with at least 3 employees. The Chamber Health Solutions Plan through Aetna, the Aetna Funding Advantage Level Funding Plan for employers with 2 to 100 employees. And then high performing health plans for employers with 100 or more employees. So I just wanted to leave you with a little post that I put on LinkedIn. So I definitely post a lot of content out on LinkedIn. So please follow me there. Let's connect on LinkedIn. But this is just a snapshot of an article I posted a few weeks ago. And it just highlighted some large employers who were particularly hard hit by the pandemic. And really, they were ill prepared to weather the storm. But conversely, a hotel in Florida that is part of the Fair Cost Health Plan had really survived so far without having to lay off anyone. So, with a good advisor and a little courage, it is possible to weather this storm and remain prepared for any upcoming crisis that might await us in the future. So I just wanted to kind of leave you with this and say thank you. Thank you from the Burke County Chamber of Commerce. Please give them a call, 437-3021, whether you're a member of the chamber or not, and just talk about how we can come together as a community and support each other through this time of really great uncertainty. Then, this is me, Christy Gupton. I'm the president of Custom Benefit Solutions. I also host the podcast called Healthcare Solutions. So you can check us out online, listen on Apple Podcasts or online at our website. Here's my email address and my phone number. I look forward to hearing from everyone on the webinar today and seeing how I can help you hit that reset button and try something different that could help you weather this storm. So thank you for joining us on the webinar. I appreciate your time, and reach out to us soon. Bye-bye.